Hi, Genesis. How are you? Well, it is 7:30, and while Genesis is getting her audio uh, on, I'll just give you some greetings on behalf of the As One Foundation, where our mission is to empower families globally, delivering life-saving sickle cell education. And we are honored and privileged and thrilled to host Trait Space, your safe place, which is the heart, soul, and brainchild of Genesis Jones, who is a sickle cell survivor and is forging her way through surviving as a post-transplant trait warrior, who came to us a couple summers ago and asked if we, because we are in this space as a sickle cell trait advocating organization, with sickle cell trait being our origin story. um, she asked if we had a sickle cell trait um, support group, and we did not at the time. Um, But as of some meetings and the technology that we're utilizing right now, we started a year ago in 2024, and we are 4 months into our second year. So, as these things go, the As One Foundation is a tiny but mighty organization, and we definitely try to meet the warriors and trait warriors, their family, the caregivers, and the providers that serve them where they are, um, in any way that we can help, any way that we can meet a need, certainly any way that we can collaborate. After all, our name is As One. That's what we seek to do. So, we sort of have taken our leadership, or at least the outline for our topics for Trait Space, basing those on the health awareness months or days or weeks. And April just really gave us a smorgasbord of topics to cover. And and did I say we were tiny but mighty? Um, with the time challenges and, needing to do 27 hours worth of things into a 24-hour day, time schedules not matching up. So we decided to just bring the conversation about all of these recognitions or observances, um, that April is overflowing with. But we also wanted to offer the opportunity for any and everyone that joins us monthly in this actual trait space support group on Zoom, but also reviewing the recordings in our YouTube, as well as in our Facebook group, to share thoughts, to share input, to share ideas, because we need it to be owned by the people. We really need someone to take ownership and coordinate and, recruit speakers and organize topics, um, because, we're just all, pulled in multiple directions. And when the mishaps of health creep in, it just adds an additional challenge. So I am hopeful that Genesis is going to be able to rejoin us, but for the purposes of actually forging through, and in the event that we do have others to join us, I'm gonna just send a notice that we are live now. So hopefully folks can join us. Um, I'll just share. And hopefully we'll have some more folks to join us live, but we do know that people are revisiting our YouTube recordings. Um, I will share that April is National Minority Health Month. Um, it is Stress Awareness Month. It is also Alcohol Awareness Month. April 7th was designated as World Health Day, Endometriosis Awareness Month, Blood Donor Month, Oral Health Month, Autism Awareness Month, Irritable Bowel Syndrome Awareness Month, Parkinson's Awareness Month, National Youth HIV/AIDS Awareness Day is April 10th. National Healthcare Decisions Day is April 16th, tomorrow. And Infertility Awareness Week is April 20 through 26. Um, Honestly, when I read this list, and I will restate it, I thought all I could think was, geez, all of these have to do with sickle cell disease and sickle cell trait, which in and of themselves, present differently patient to patient. I heard um, a beloved doctor in this community. I don't know if she's the originator, but I heard Dr. Wanda Sherney refer to sickle cell disease patients as presenting as butterflies, unique. There is not one butterfly that is identical to the next. And I would, further that consideration for those that live with sickle cell trait. Each patient presents differently. What one sickle cell trait, symptomatic sickle cell trait warrior symptoms may, definitely present differently, if at all, with the next person with sickle cell trait. And within that spectrum, that is sickle cell disease and sickle cell trait, and throughout that spectrum, each of these observances is relatable to sickle cell trait and disease. So I did a little more digging, and certainly if you have any thoughts that you'd like to share, you're welcome to unmute or type them in the chat. The information that I have says that National Minority Health Month was established by the United States Department of Health and Human Services Office of Minority Health in 2002 to elevate efforts to reduce health disparities and promote equity in underserved communities. Um, uh, this is particularly timely in the times that is the today, the moment that we're living in, when we're seeing any effort, especially that can be categorized under the diversity, equity, inclusion, being eliminated. And in real time, our sickle cell data collection, um, the blood disease initiative, all of that is under threat, and motions have been made to eliminate it, and we are actively protesting. I participated in a letter writing campaign, and hopefully we can have our congresspersons to reverse that decision, because all of the data, and I'm even told that there is sickle cell trait data that has been collected that has, been the impetus for positive changes and impact, and even, the production of policy that ultimately increases the quality of life for the population that we serve, that has gone away. And certainly the result of that is funding and the lack of research, or the elimination of funding and research, much needed funding and research. So, um, National Minority Health Month is gravely important, even though the consideration that sickle cell only affects African Americans is the widely used categorization that is poorly, underrepresenting the truth, which is that sickle cell affects people of African, Asian, Indian, Latin, Italian, Irish, Mediterranean, um, Greek, Turkish descent. So literally anyone can be affected by sickle cell disease or trait. It is not a skin color condition, it's a blood condition. And we know from our genetics information that we are 2% of us, each of us is represented by what we can see, our skin color. But you cut my arm open and look inside of me, you cut me open, I'm no different than the next white woman or the next Irish woman. We are more genetically alike than we are different. So the consideration that there is not a need for um, diversity, equity, inclusion efforts is highly debatable. There are plenty of folks of color, red, white, blue, red, green, yellow, black, white, as the song goes, that need the National Minority Health Month to continue to raise awareness to reduce health disparities amongst these populations and promote the equity that's needed by these underserved communities. The next one is Stress Awareness Month. Um, I am mindful of stress as a 53-year-old Black woman who has thankfully never been diagnosed with any other comorbidity outside of obesity. Um, but stress is one of those things that does concern me, because it just, it just, there's a spectrum, and there's not really a scale. Um, it's like being pregnant. You're not kind of pregnant, or a little pregnant. You're pregnant or you're not. And that's the way that I see stress. You're stressed or you're not. But stress, has been reported to be potentially fatal. It can manifest physically, it can manifest mentally, emotionally. It was originally recognized in 1992 by the Health Resource Network, also known as HRN, and focuses on educating us on the impacts of stress and offers tools for mental wellness. And there is a beautiful woman in the sickle cell community. Her name is Elle Cole. Her business organization goes by the moniker Cleverly Changing. And she established a tagline, a movement. I believe there's a documentary, but certainly social media messaging that simply says, I believe in therapy. And certainly one of the things that therapy and therapeutic experience can help us, and that is it can help us manage stress. And certainly our sickle cell warriors' pain can be stressful. And then you add the layer of being mistreated by undereducated providers or insensitive providers, or just people ignorant that don't understand, can be stressful. And then just trying to be normal, um, and your normal is to live with excruciating pain, that is stressful. So again, April has really laid it out for us to be aware of all of these observances, to bring it back to center, and to understand that people living with sickle cell and sickle cell trait are people. that are living with all the other things that can, unfortunately create stress. So let us be aware of stress, and let us, look into, Google, everyone, Google, I believe in therapy, and look at those resources. I mean, there are so many ways to access talking to a person, finding a therapist, going to a forum. There are many safe places now that are available. You don't even have to leave your home. You can download an app. Artificial intelligence is now, uh, a vehicle through which to access some meaningful therapeutic intervention. And we got to get creative, because I want us all to live, but I also want us all to live as quality as possible, and that is um, with the emphasis on stress reduction. I would definitely love to hear your voices about how you manage stress. Another thing is, I'd love to discuss how we can, as people in the sickle cell community, how we can advocate, or what exercises, what experiences have you had um, with addressing stress, or even the Stress Awareness Month awareness activities. How have you addressed the National Minority Health Month, and how do you suggest we do it? Would love to hear, see all of your comments in the chat, so please chime in. The next one is Alcohol Awareness Month, originally started in 1987 by the National Council on Alcoholism and Drug Dependence, also known as NCADD. The purpose was, or the focus was, to raise awareness of alcohol misuse and supports prevention, treatment, and recovery. Um, how does this relate to sickle cell? How does this relate to sickle cell trait? Like I said, sickle cell people living with sickle cell are people. People living with sickle cell trait are people. So, of course, alcoholism and, has presented in the community. And sometimes it is a coping mechanism for pain, or any of the other uh, issues that are experienced by those living in this community. Um, how can we be more culturally sensitive? What can we do in the sickle cell community to acknowledge Alcohol Awareness Month? What can we do to support our warriors or our family members that may be suffering? And in general, what has been done? What have you done? What has been successful? What was a fun, opportunity to raise awareness and make a difference? We'd love to hear. We'd love to hear. We just are April 7th, just a few days ago, World Health Day. World Health Day, founded by the World Health Organization in 1950. Unfortunately, the United States, I believe, is no longer affiliated with the World Health Organization, according to as per this new administration. But the World Health Organization is definitely a public health forward organization, and established this World Health Day to raise awareness about pressing health issues, um, and changes themes annually. Um, so how, and certainly sickle cell is a global condition, that is not just affecting people living here in the United States, or in one particular area. It is a global condition. So, um, what if you could choose the next global theme for World Health Day? What would your theme be? Um, I mean, any of these that we've discussed so far would be great. But what would your theme be for World Health Day? Um, the next is National Endometriosis Awareness Month. Uh, raises visibility around endometriosis affecting 1 in 10 women. Another lesser known chronic condition that we need to raise awareness about. And how does this affect women in the sickle cell community is definitely up for discussion. Have you had any experience um, in this area? Have you seen any great interventions that would be great for us to implement? You know, as a leader of a small charitable organization, like I said, we are tiny but mighty, and definitely believe and work toward having major impact, regardless of our manpower or woman power. Um, Collaboration is key. You know, it doesn't matter what our budget is. What matters is how we can make uh, light work of, you know, utilizing many, the use of many hands. And your trait space, your safe space, your safe place. Trait space, your safe place is certainly an example of collaboration to make a difference. So as a small charity, we certainly don't have to reinvent the wheel, as that terminology says. We love to look at what's been done well and try to implement that. And as we do things repetitively, we, you know, evaluate and do it better the next time, and rinse, repeat, as they say. So we'd love to know what your ideas have been, what your experiences have been with regards to any of these subjects. I see Genesis has joined us. Genesis, are you hearing us? I've just been going down the list of the observances for the month of April, starting with National Minority Health Month, Stress Awareness Month, Alcohol Awareness Month, World Health Day on April 7th, National Endometriosis Awareness Month. All of this is in April. And we are at National Blood Donor Month. Of course, this definitely has a sickle cell consideration more than it is traditionally in January, but some organizations promote it again in April for spring drives. And we definitely, as an organization, our goal is monthly blood drives, but dealing with a specific, you know, our certain our list. The advising is to do a blood drive every 50 to 53 days. So that makes us um, quarterly. If we can add other, you know, locations and not be feeding from the same list, then we can, you know, reach our goal of monthly donations. But of course, life-saving blood is important for our population. Life-saving blood is important for so many populations, but certainly those living in the sickle cell community that could experience the need for as many as four or more blood transfusions monthly, where the blood is diluted, the sickle cell blood is diluted to, you know, eliminate so much of the disease in the blood, and give our warriors a reprieve from the sickling, the crisis, the pain, etc. Um, the As One Foundation is actually planning two donation drives coming up, because, as I said, one of them is going to be at a different population. So Memorial Day weekend, we're partnering with the Total Performance Fitness. And depending on when you hear this, hopefully you can visit our website, our social media, and sign up to donate and meet us there on Memorial Weekend, May 24th at Total Performance Fitness in Stanford, Texas. And then the following month, which is June, for World Sickle Cell Day, our World Sickle Cell Day Juneteenth Jubilee. The long name is a World Sickle Cell Day Juneteenth Jubilee Therapeutic Summit Blood Drive and Health Fair. That will be on Saturday, June 21st. But uh, my blood type is that blood that can be used by a lot of different people. So I definitely make it my business to donate every 53 days. Um, and it's not just people of African descent, but people of African descent are truly underrepresented when it comes to blood donations. We need to give more. And Black blood saves lives is not a term that I came up with, but it is a term that emphasizes the antigen match that our blood, as in people of African descent, can have for people living with sickle cell to eliminate that rejection. Every ethnicity needs to donate more, but certainly people of African descent and other ethnic minorities need to donate blood. And I encourage you to please do not decide, oh, I'm taking diabetes medicine, I can't donate, or I have high blood pressure, I can't donate. Let the blood donor collection folks tell you that you are not eligible. If you've had a tattoo, you can donate. If you've traveled out of the country, you can donate. It's a timing thing. So I'm saying go and let them tell you um, that you cannot donate. But by all means, find your local blood bank, American Red Cross, Gulf Coast Blood Bank, wherever you are, the Red Blood Coach, Give Blood. There's a numerous names of organizations that are collecting blood, and it is still a blood shortage. COVID-19 kind of started, not COVID, yeah, COVID-19 in 2020. Um, a lot of all the blood collection dates were canceled, which directly led to a blood shortage. And we've not gotten to a place where there's a surplus yet. And like I said, it's not just sickle cell disease folks that need blood, people that have been in accidents, cancer patients, and so on. So, I believe you can donate as young as 12 under parental supervision, uh, 16 and beyond. And there are people that have donated thousands of gallons of blood. So all of us, and it is the gift that keeps on giving. You donate blood, and as you're donating, your blood already starts to regenerate. So every 52 days, I believe, is the timeliness. So you can donate as many as 4+ times per year. Um, let them tell you. Again, important for sickle cell. And then there is National Oral Health Month. This is very important for sickle cell, and sure Monica and our folks over at the Potter Smile, who they have a sickle cell charity for dental charity for sickle cell patients that they are certified to treat sickle cell patients because of the bone density issues that are suffered by people living with sickle cell. You can't just go and have an implant as a sickle cell. It's not advised. There's a certain way that you have to treat our sickle cell warriors that have dental issues because those are bones and there's marrow and there's loss and cellular damage and all of that. So it has to be treated differently. So National Oral Health Month most definitely has relevance to the sickle cell and sickle cell trait community. So stay tuned to Project Smile. Uh, the goal is to try to raise money to treat sickle cell disease patients free of charge, which costs approximately $10,000 plus per patient. So there's a fundraiser going, and of course, the Potter Smile, they do their Sickle Cell Saturdays in Houston with Dr. Morency and Miss Linda. Check them out. Do a Google search and check them out, and take care of your oral health as a sickle cell warrior and trait warrior. Autism Awareness Month, first recognized in April of 1970, supports acceptance, understanding, and inclusion of individuals with autism. And again, when we use the terminology diversity, equity, and inclusion, it is not just about the inclusion of Black folks. It's the inclusion of people that need access to buildings, but they move around in a wheelchair. That is inclusion. Certainly, the LGBTQ, that is also inclusion, but autism, people that can function, but function differently. People that have sensory issues, and the fact that they can now live in a world that is sensitive and does make allowances for those special types of needs, that is inclusion. It is not just, affirmative action for people of color. So, and there's even some research that I'm aware of um, that correlates sickle cell with autism. I'm aware of a number of sickle cell trait young people that are on the sickle cell, on the autism spectrum. And hey, more research is needed. That's just the bottom line. More research is needed. So that's another observance in April. Irritable bowel syndrome awareness month, um, designated by the International Foundation for Gastrointestinal Disorders in 1997. Um, Sickle cell people are people that have other comorbidities as well. So again, see your doctor, check yourself out. And of course, a person living with sickle cell disease may be suffering other things as well. So all of these things that are, observed in April are important to be aware of. And there's some other observances like Parkinson's Awareness Month. Um, and all of it is important. All of it is important, and especially when there you have the layers um, but I'm not going to belabor the hour. There's National Youth HIV/AIDS Awareness Day on April 10th, National Healthcare Decisions Day, which is noted for April 16th, which is tomorrow, but encourages advanced care planning and conversations about end-of-life choices, and not to be morbid, but of course, this is responsible planning. As a person that's had to do this for um, a person in my grandmother, it's important to know what they want, but it's also, it kind of helps you uh, when you're in the grieving process to have a plan of action as opposed to trying to figure out, what to do and you know what not to do. And then finally, Infertility Awareness Week, which is coming up on April 20th and 26th. SC Red and Tiana Wolford has an awesome sickle cell organization that's all about reproductive decisions. As we know, the post transplant, where there is the genetic, I'm trying to think of the actual. So there is the bone marrow transplant, and then there is the gene editing that have the potential to leave the patient um, infertile. And that infertility can be addressed by, freezing your eggs, or, going through some other fertility exercises prior to that. And her organization is really on the forefront, on the front lines of providing that type of education and even that service free of charge based on their funding. So, again, April is chock full of observances that are related to sickle cell directly and indirectly. But we wanted to bring those to your attention. I know we've had some audio issues, but Genesis, I see you there. I'm going to close it out unless you have any final words that you'd like to share with us.
I just wanted to say thank you for honing everything in, Dr. Austin. Yeah, April has a lot to showcase, and yeah, thank you for holding it down for this month. I think there's a lot to show for April. I think there are a lot of people that have to be able to recognize for this month, and yeah, no other words. Thank you, Dr. Austin.
Sure, and thank you so much for forging through. I know technology can be technology. We're praying for you, Genesis. You are just one of the most amazing warriors, and we really appreciate the opportunity that you birth with this trait space. We're looking forward to next month, May, every third Tuesday. I forget what our topic is for next month, but certainly if you're watching this, please join us. Same time, same place, uh, at Trait Space, your safe place. This is Dr. Tamia Austin with the As One Foundation. See you, everyone. See you next month.